Okay, so can you tell me a little bit about sepsis before you start? So just to refresh your memory.
Sepsis, the patient will mainly come with fever maybe, and they will have a source of infection. They can be also confused at the same time along with that fever. So for the source of infection, we have to ask about, like, it can be either the respiratory tract infection or from UTI or like anything else, any kind of infection.
Okay.
And in sepsis, like, I don't know what to say in the history part, but in the management, I know that we have to do that sepsis 6, where like initially we will start from A, B, C, D, E, but mainly here, I don't know what to say, to be honest. I know the management, I can say that, like, what are the management and treatment or investigation that you have to do.
All
So
right. Yeah, first to say this patient has sepsis. Like you mentioned about source of infection and fever. What else in the vitals can be?
Yeah, they can have hypotension, oxygen saturation can be low or it can remain normal. Then their urine output, it can be diminished. And also, like, they can have some imbalance in their ABG level, like and because of anaerobic respiration, they can have lactic acidosis in their body.
All right. So sepsis, it's a systemic inflammatory response plus known source of sepsis infection, as you mentioned. So systemic inflammatory response syndrome, we say it when we find two of these vitals abnormal, like heart rate more than 90, respiratory rate more than 20, and temperature less than 36 or more than 38.3, and white blood cells less than 4 or more than 12. So this is systemic inflammatory response. If we know this patient has infection, known source of infection, whatever it is, UTI, chest infection, so we will call it sepsis. But that's why vital is vital in sepsis. And anyway, we're going to do is SIMAN, so we know that. But if the patient like doesn't have, his vital is normal, he can't have sepsis. We just say pneumonia.
Okay.
Okay. And severe sepsis if there is organ failure. So like severe hypotension or any organ failure. So we call severe sepsis. And septic shock if the patient not responding to the fluid, has hypotension but is not responding to the fluid killing. Okay. So this is the major things in terms of symptoms of sepsis. So it could be like symptoms of the source of infection, like if they have, for example, say chest infection, they will have shortness of breath, cough. If they have GIT, gastroenteritis, for example, they will have diarrhea and vomiting and nausea. If they have urinary symptoms, UTI, they will have urinary symptoms. And also it can come with loss of consciousness, as you said, and it comes with very high temperature, and they can have confusion. In terms of past medical history, they could be immunocompromised, so it makes things worse. We know that we're going to admit them. Recent flu-like illness, we can ask as well. And any medication that can drop the immunity, like steroid, chemotherapy, and family history, recent contact with any person who has infection. And we will do APC approach, as you mentioned, if it is SIMAN station. But if it's not SIMAN, also we will start with your vitals. So you will mention about, I will check your vitals. And if it is sepsis, they will bring it as SIMAN, unless it is UTI infection, it's not sepsis. Or some, like one day they brought it like, yeah, sepsis, but they have a news chart in the room. So you will still be able to know all the vitals. So you can confidently say that it's sepsis, because if the vitals normal, it wouldn't be sepsis. So sepsis has to affect the vitals. All right.
So if they have the news chart, will they give the monitor at the same time?
No. So if SIMAN, there will be monitor connected to it, you will see. Otherwise, if it's not SIMAN, they brought just mannequin, not the whole SIMAN, like just tummy, and it's only tummy mannequin, they brought it like this. So he has UTI. So they will just have the news score. They will tell you special news score inside, or you will see it in the table even, or in the wall. So it will be very obvious for you to find it, yeah. And even if you didn't find it, if you say just, I'm going to check your vitals. So when they brought it like sepsis in Nottingham, man, they brought the daughter with this mannequin. So you will tell the daughter, now I'm going to examine your father and I will check his vitals, which includes checking his pulse, blood pressure, oxygen saturation, whatever you will name them. So she will tell you, doctor, the nurse did it, and this is the papers, for example. So they will guide you. So it shouldn't be a problem now. And as you mentioned, sepsis 6, this is the easiest part about it. Still the treatment, it has to be same order like ABCD. So we will, first step, we'll give oxygen, 15 liters per minute via non-rebreathing mask. And you will put the cannula to take blood cultures before starting the antibiotic. And then we'll give broad spectrum antibiotic according to hospital protocol. And you will give fluid challenge in divided doses. And you measure the serum lactate and urine output. All right, let's do it.